This is Bonnie Vandermeulen, Training Coordinator for Wisconsin Facets. On behalf of our entire Wisconsin Facets staff, I'd like to thank you for joining us today. Our webinar today is entitled Goals for Children, Helping Families and Children Create Goals, and our speaker today is Becky Burns. Becky Burns' career centers on supporting children and families whose lives have been affected by unanticipated journeys through the world of disability services. She treasures opportunities to work with these families and the professionals who support them. With a Master's of Science in Social Work, she uses her education along with her personal experience to being raised with a sister who has a disability to influence her work with families. She has worked in one capacity or another for the state of Wisconsin for many years and presently serves as the statewide coordinator of the Wisconsin Children and Youth with Special Health Care Needs. It is my great pleasure today to introduce to you Becky Burns. Becky?
Thank you so much, Bonnie. Thank you to everyone here, and good afternoon to families in Wisconsin and the providers who support them. Indeed, I am Becky Burns, and I do serve as the statewide coordinator for children and youth with special health care needs. This afternoon, I'm going to spend some time telling you about a project that started a couple of years ago that resulted in a web-based application for families to help create goals for their children. I do apologize that my notes are on a different monitor, so you're going to see me turning sideways. So I hope you're not relying on lip reading for this presentation, but I'll do my best. So years ago, I was on a team that included doctors and care coordinators at two complex healthcare programs here in Wisconsin, one from Madison, one from Milwaukee. And the focus of our team was to incorporate the use of a shared plan of care into every clinic visit. One critical feature of a shared plan of care is to integrate the family's goals and determine together how those goals can be met. The staff at the clinic were finding that when they asked parents about the goals that they had for their child, they often got a response that looked a little bit like a deer in the headlights. Families either didn't understand the question or they weren't quite sure how to answer them. So we turned our attention to how can we help families create meaningful goals. We started with a brainwriting exercise. If you're not familiar with brainwriting, it is similar to brainstorming, but it can be used to generate new ideas and encourage creative problem solving and develop innovative solutions. But instead of getting people to discuss their ideas out loud, brainwriting gets people to write down and share them anonymously. What came out of that exercise is that we needed to create a guide for developing goals. We researched and we found a diabetes clinic in Denmark that was using goal cards to help their patients. And we really liked that idea. So we created an initial deck of goal cards that was really big. It had 60 cards in it. So we worked with about 45 families who reviewed the deck and responded to each of the cards, indicating if we should keep it, change it, or simply get rid of it. And through that process, we reduced the number of cards to 39 and incorporated some of the goals from suggestions that families offered as they were reviewing them. Our next step was selecting photos to accompany each goal. We focused on high definition photos with people who have disabilities that represent various races, social economic status, etc. By the way, there are not many high definition photos of children with disabilities, much less those from a variety of races. Certainly a project that we'll have to add to our list. But upon review of these cards with the photos, some families recommended that we use images instead, which would represent the idea of the goal rather than the photos, so that the children using these are not put off by factors of the photos. For example, the age of the child in the photo is clearly too young or too old, or the family that's on the photo doesn't represent their family. And then we had them review them again. So I'm hoping you're hearing that throughout this whole process, we worked with families to give us feedback and tell us what to do next. So another group of families reviewed them, and another parent came up with the idea of line drawings. And they thought that those would be most helpful for any children or youth who use a picture exchange communication system, or PECS. So we selected black and white line drawings for each goal. Then we had every card laminated, and so they could be used repeatedly by a variety of children. Then COVID happened, and no one was using the laminated cards. Like everyone else, we pivoted. To accommodate televisits or telemedicine, we created an online list of the goals and combined the images as you see here. Now professionals who were using televisits with families could pull up a visual list of goals and go through them with a family online. In total, our final set of goal cards includes 39 goals divided into 5 categories, including communication, home and family, community, social and school, independence, and medical and health. The categories were created to help families narrow the number of cards that they needed to review if they already knew ahead of time kind of what category of goals they were interested in or what category of goals they were not interested in. Here are the 39 goal cards, starting with communication. Have others listen and understand me. Improve my ability to communicate. Learn how to tell others what I need. Understand and express my feelings. There are 9 goals for community, social, and school, including be part of my school, be safe in my environment, experience my community, feel like I belong in my community, get help at school with blank, fill in the blank, go to camp without my parents, make new friends, play more, and reduce behaviors that hurt others. The third category was home and family with another 9 goals. Find a care provider to help at home. Get support from my brothers and sisters. Have an accessible home. Have my parents spend more time by themselves. Have someone help find and coordinate community services. Have transportation I can use with my family. Help get myself dressed, improve my hygiene, and take vacations. Next were 6 goals for independence. Accept my differences, be more independent, be treated with respect, have a hobby, make my own decisions, and use technology. And the final category of medical and health has 11 goals. Access more therapy opportunities, describe pain and other physical symptoms, get better sleep, have equipment that is made for me, have fewer medical appointments, learn about my medications, learn healthy choices, learn how to use my equipment and supplies, make the switch to the adult healthcare system, receive good dental care, and spend less time in the hospital. Throughout these cards, did you hear any goals that perhaps you would select for your child? Can you see how perhaps reviewing these goals could help a family think of other goals that they haven't included in the past? So we made the cards available in both English and Spanish, which covers about 95% of the population here in Wisconsin, with Hmong being the next language we need to consider. And we created a manual for providers, so they would have additional questions that they could use with families to help clarify their goals and offer some resources if families wanted to get started on those goals right away. We made all of these materials available through the Department of Health Services Publication Library, where they exist today. Before the use of goal cards, one parent expressed, goal setting often feels like an exercise in reverse engineering goals to simply justify a product or a service. In order to purchase something with the CLTS waiver, our new caseworker, she's always like, well, what would be the goal for purchasing that? But by using the goal cards, a parent shared, the nurse brought out the goal cards and it was a really positive experience. It was neat to have someone sort and make piles with their child. It was tactile and it was neat to see the ones that she picked. versus the ones I imagine she would pick. One of the greatest aspects of this work is hearing from families who have tried using the goal cards. We hear a common theme from families that parents are surprised about the goals their children select, and that the goal cards help them think of goals they would not have considered in the past. Frankly, if even 1 out of 10 families use these cards have that experience, a whole project will have been worth all the effort. Giving kids a voice to select their own goals for their own lives was a really unexpected bonus of the work that we have done. Now I'd like to share a video with you that I think will help explain the project, but I'm going to share this. Here we go. Let me introduce you to 3 parents who have a child with a special health care need or disability. Does this sound like you?
Hi, my name is Martin. My son Sebastian has an IEP meeting tomorrow. I wonder how it will go.
Hi, my name is Emma. My child Charlie has their annual review for the Children's Long-Term Support Program coming up soon.
Hi, my name is Diamond, and my daughter Jasmine will be meeting with her medical team soon, and will be updating her shared plan of care.
Oh no, these parents know that they will need to come up with goals. Goals for the shared plan of care, goals for the CLTS waiver, and goals for the IEP. Relax, we are here to help. There's a website at goalsforchildren.wisc.edu that can help you create goals for your child. With examples like be part of my school, get support for my brothers or sisters, or receive good dental care, or have a hobby, access more therapy opportunities, play more, or many others. With this app lending a hand, you will be ready for your next meeting, ready to share your child's goals for their life, rather than different goals for IEPs, waivers, shared plans of care, and any other programs. Take some time with your child as they are able to select goals that are meaningful and be prepared for your next meeting. You can do this, and you'll be glad you did. Thank you for watching.
So Becky, I do have a question for you if you don't mind.
Perfect timing.
Okay, and that's if we were to go to the website goalsforchildren.wisc.edu, would we be able to like download copies of the cards to be able to use ourselves? Is that what's available that way?
Yeah, good question. Not exactly. The cards live on the publication library for the Department of Health Services, which you as a citizen of the state have access to. So that's where you would find those. If you go to the website, you're going to see this application, this tool that you can use to select the goals that you would like for your child. So let me go a little bit further into the description of the application. Up till this point, I'd share that we have the individual cards, and then we have this essentially a PowerPoint of all of the cards in one. So the next generation of our goal project was to turn the goal cards into an online application for families. And what better time to do this than during a pandemic when more and more families are going online for every aspect of their lives. So this short video has described what that application is all about. So now that we've launched this website, most families are finding that they prefer to use this form of the goal cards with their children. They can take their time, consider all of the goals, and then get a document in the end that records the selections that they made. They're able to write in their own goals and their own answers to all the questions. They receive a follow-up email that gives them a link to return to their work at a later time. The next few slides will offer a peek at the primary sections of the application. So it starts with the ability to select which categories of goals the family wants to consider. In addition, of course, all of the above is an option. So for each goal, a family can indicate if they are interested or not. If they are interested, the application will ask 1 or 2 follow-up questions. If they're not interested, then they'll simply move on to the next example goal. This is an example of a follow-up question to learn more about what does it mean for a child to be part of their school. With this added detail, it was easier for professionals supporting this child to start to address the desires that this family has. Here's another example. This follow-up question helps identify the type of support the child may need to make this goal a reality. Again, these follow-up questions help narrow the scope of the goal. In addition, every follow-up question offers the option of something else, which the family then can write in any information they want, and it'll be carried over to the document provided at the end. Towards the end of the application, every family indicates which programs ask them to set goals. We use this information to track how many programs most families are involved in, but we also list these on that final document that the families then can share with others. And we hope that this will raise awareness so everyone involved in supporting that child will have a better appreciation of the burden that is set on parents when they ask for them to set goals. At the very end of the questions, families are offered 4 different formats to view their selections. You can ask just to see the goals, goals and resources, goals and action steps, or all of it together. The resources offer books or articles, videos, websites, and programs that are available that would support the goal they've selected. Now, I have to say, in some of the feedback we received, families have said some of those resources seem pretty basic. And I guess that's where we thought we should start. So if a family was new to the whole system, they would get some basic resources to get themselves started. But it was good feedback for us to consider maybe some additional resources that are a bit more advanced. The action steps help families understand what supports they can ask for from schools, doctors, the Medicaid waiver staff, and the Children and Youth with Special Health Care Needs program in order to help achieve their goals. So this is an example of the documents families receive at the very end. As you can see, it starts with a listing of the programs the family indicated that they're engaged in that request goal setting in order to access supports or funding. Then, for each goal selected, the document reminds them about the additional answers they made to the follow-up questions. Finally, the resources and action steps are listed for the
Hi, Becky. I think we've just lost. Yeah, we just lost you there for a minute. Are you back with us?
I am. I'm trying to see, are you seeing the screen?
Yes, I'm seeing you, but now, yeah, there we go. We're back the way we were. Sorry for the inconvenience, everybody. Technology sometimes is wonderful when it works.
Very, very true. So as I was mentioning, some families who've been navigating the system for years don't find these to be very useful, but do acknowledge if they're new to the system, then this would have really helped them back in the day. So share what you think as we continue to modify and adjust this over time. It's always, of course, a challenge to make one system that's going to meet the needs of all families. So here are some of the early responses to the online application that we received from some parents. I think these are fantastic. They're an easy way to identify goals and to help generate new ideas for goals. The site was well done, easy to follow and complete. It didn't take a ton of time. So I believe parents can complete this within their schedules and not be yet another burden. I think the concept is wonderful. Years ago, I was at a conference and I listened to families and parents describe the burden they experience creating goals for their child with a special healthcare need. Everywhere parents seemed to turn, they were being asked about goals. In school, at the doctor's office, and with their social worker who oversees their Medicaid waiver funds, they had to create goals. Our ultimate aim is to shift the paradigm of goal setting for families in Wisconsin, so that rather than setting and creating different goals for each system, we want there to be one set of goals for one child, and let the professionals figure out how to customize their support to meet those child-centered goals. I like to think that this was the original idea when goal setting started, but somehow over the decades, the focus has moved more to the programs and away from the family's needs. And we need to get the focus back on child-centered goals. Our next steps include continuing to listen to families. We want to make this project work for all types of families, and that'll only happen if we keep listening and modifying as we go. We also want to support providers to better meet the needs of children and families. We've applied for a few grants, and if awarded, we have some robust plans to spread the use of the application across Wisconsin, as well as to other states that would like to join in this effort. And as promised, I'm not using up near as much time as I thought. So as I wrap up, I just want to thank you again for listening. It's a pleasure to share our work with you, and I will entertain any and all questions that you may have.
So Becky, thank you. We do have a couple of other questions. One is, have these goal cards in themselves been like distributed to doctors' offices or some of these other institutions where they could utilize them when working with families?
They have, and we certainly have more copies because we didn't distribute them anywhere near as broadly as we thought we were hoping to because of the pandemic. So I can certainly say that our two complex healthcare programs, the one in Milwaukee and the one in Madison, do have sets of all three types of cards. And I have a stack of them in my office that we can mail out to someone who's interested in them. Keep in mind that one of those sets is the photos, one is just the images, and the other one is the black and white line drawings. So in the physical cards, at that stage of the development, we hadn't combined the photos, the images yet. So you're welcome to have a deck of each set. You're welcome to have just whichever one you think might be most useful. So yes, those are available.
Another comment said, it seems to me that it would be of great value if the family themselves could have a group of these cards to be able to utilize at home. Then they can work with their child before they go on a visit, for example, to the doctor, or before an IEP meeting that the child might want to participate in, for example.
Yeah, it's a really good question. We don't have the volume of cards to be able to support that. What we envision for that is the use of the online application, because then you can sit at the computer with your child. I know it's not as tactile. It would be lovely to have the physical cards and have abundance of them so that we could send them out to all families that were interested. We send them to providers because then we're hoping one deck actually gets shared with many families. The other option is to use the online version. And Bonnie, I don't know if you and I can work together to send the link out to folks after this presentation. But we do have a link to the online version that just shows you all of the cards, both in English and in Spanish. And that might be another way you could work with your child. The other option, I'm sorry, as I'm just thinking aloud, is that you also can download the actual cards from the Department of Health Services publication library and have them right there at your home.
We would be glad to help distribute that link. If you would want to send that to me, then we would be able to send it out to those that participated or those that might like it. So that would be great to be able to do that. We would appreciate that as well. So another question comes in from, I believe, a parent that says, how would you begin to try to engage your child in the use of such cards?
Right. So that's what was kind of surprising for us. We weren't sure how that was going to go, but we found in our first pilot within the medical clinics that the kids could sort them. And they, some of them, you know, we kind of imagined that they would sort, yes, I like this goal, and no, I don't want this goal. Some of them went as far as to saying, I like this goal for now. I can imagine I'd like this goal in the future, and I have no interest in these goals. So either it's by their ability to read or having a parent read the card to them, or the pictures on the card. I don't have data supporting which way they were able to engage with the concept, but they were able to sort those out and start to express their own interests and goals.
And this is another comment from a parent as well, saying that, you know, this is a great idea. I might want to develop some of my own cards to work with my child and maybe be able to have the child utilize them with their teacher, for example, at school.
Very good idea. Very good idea. Yes, absolutely. Our concept here is that we get to what does this child want? What are their individual goals? And then, you know, at the IEP meeting, be able to say, here are my goals. This is what my child selected, or have the child bring the cards themselves or the printout from the online application. And then, you know, work with the teachers, work with the therapist to say, you know, what can you offer? What can you do to help my child reach this goal? And that's a little bit of a new way of thinking for some of our providers and professionals, not for others. It's not going to be universal by any means. I remember I did this presentation for our CLTS waiver staff, and they said, yeah, but what am I going to do if a child says, you know, that they want to spend less time in the hospital? Oh no, actually the example was have fewer medical appointments, but it really doesn't matter. They said, you know, I'm a case manager. I don't have a role in that. And I beg to differ and say, you know, if you could work with that family to help them call their doctors, arrange their appointments, maybe, you know, multiple appointments in one day, or could you help them better understand what telemedicine is and how they might have some of their appointments by telemedicine so they're not traveling so far to receive care. So I really do think that regardless where the professionals are, they can find a way to support these goals and support the family in reaching these goals. We have heard, I'll just share it because it just reminded me, we have heard some parents say, you know, it'd be really nice if you had a deck for younger children, like children under 5. Because some of these are pretty lofty, you know, switching to adult health care for my 3-year-old, that I can't even kind of relate to that. So that's an idea we're considering. We tried to the degree possible to keep them general enough that then a family could take that and make it their own, or make it, you know, fit for the needs that their specific child has. Similarly, there have been recommendations that we make older teenager kind of transition deck for the older, our older youth who are having to create goals about what are they going to do after they leave high school, or you know, transition into their adult life. So great ideas. We had funding for this original project. We don't have funding now, but we're trying to do it as we can, along with our regular work. So we love suggestions.
I'm glad that you touched on the transition, because one of our questions was, is there any thought about creating a transition specific deck?
Excellent. You're right on. Same thoughts that we've heard repeatedly. And definitely we would like to do that. We're working with the LEND program, which is a program preparing a variety of disciplines to work with people with disabilities. And we have one of the LEND students working with us right now. So that's a way I can kind of capture some work without having to fund it. And she's doing some nice research about what goals have families selected thus far, so we can see if any of these goals that we've created, like nobody's selecting it, then we can dump it and look at a different one that we can add in. She's also very interested in transition age youth, so I'm anticipating as time allows that she will also be trying to pull together the right types of cards for those older youth.
And then I do have one other comment that says that I have a child who's basically nonverbal, and this would be a great way for my child to be able to participate in the meetings and discussions. And I think this is great.
Yeah, that's awesome to hear. And as I said, we've just been astonished at the responses from parents and the, oh my goodness, I had no idea they wanted that. Is a fairly common response after the kids have a chance through the cards and sort them themselves. And, you know, for another example that one of our pediatricians offered was that the child selected that they wanted to play more. And as they explored that, they learned that they really would like to go to a park. But the parents expressed, but we don't have parks that are accessible for our child. You know, we don't know of any such park. So the doctor was able to share with them where the accessible parks are in their community. And that was great. The family just loved that. They had no idea there were such things as accessible parks. So it's just been fun to take a simple goal and see what it can, how it can unfold for a family. And never do we want these to be limiting for families, like you have to pick what's written on one of these cards. But we hope that, you know, even something like improve my hygiene, there are so many ways you could go with that. Maybe it's more about toilet training. Maybe it's more about, you know, independently brushing my teeth. So, you know, don't ever get locked into it has to be what's written on this piece of paper. We really are just trying to do it to get those ideas popping in people's heads about what possible goals are there. Because again, our experience, and boy, I get it, that being asked to set goals for your child is just not a natural thing. And frankly, people that are raising children that don't have special health care needs are never asked that. So it's not a typical question to be asked. And then we turn around and ask it everywhere a parent goes to receive support and services. So bad on us service providers, but this might be a way to kind of mend some of that and help families figure out, what do you mean when you ask me to set a goal for my child?
We do have another question that's come in. It says, what is the age range or grade targeted for the current cards? My son is 5 and has ASD.
Yeah, you know, our goal was that it was for all children and youth. That was what we're aiming for. And again, it's about modifying them, right? So where an older child may say, I want to be more independent, meaning they want to learn how to drive a car. A 5-year-old being more independent may be that, you know, I want to pack my own lunch in the morning before I head out to school. I'm totally making this up on the fly, so I apologize if no 5-year-old packs their lunch. That was probably a little advanced for a 5-year-old. But anyways, I think you get my point. If the ultimate goal is to be more independent, there's a ton of ways kids can be more independent. And then, you know, that's the next job of those supporting that child and supporting that family to say, well, what does that mean? What does it mean to be more independent? You know, what does it mean to be able to express your feelings? What does it mean for you to be more, belong more in your community? What, you know, what do we have to do to make that happen for you? So they're intended for all age groups, but we absolutely expect there to be modifications to make it work for that individual child.
Okay, and we have another comment that's come in. Has there been any process to share goals from one area to another, like the shared plan of care or the care map is shared?
Yes, totally. You're nailing it. That's exactly what we want. We want families to, and ultimately a child, to have a set of goals. These are the things that are important to me. And they take that same set of goals to their doctor's office, to their school, and to their waiver program. There's no need to have IEP goals and waiver goals and shared plan of care goals. There should be Johnny's goals, and everybody should be helping Johnny reach his goals. So that's exactly what we're hoping by this, and why we offer action steps in the application. So that if you're wanting more therapy experiences, you know, to help families think, okay, how can I get that? I can go to the school. I can talk to the school about more therapy. I can talk to my doctor about more therapy. If it's a therapy that's not typically funded, I can talk to my waiver staff about how to fund the therapy that my child needs. If I don't know therapists in my area, I can call the Children and Youth with Special Healthcare Needs Regional Center, and they'll let us know where we can get that kind of therapy. So there's one goal and 4 different ways to support that goal. And that's ultimately what we're trying to do. And they could be shared right along with that care map, which makes just a perfect pairing to really fairly quickly let folks know the challenges that the goals that you want and the complexity of that child's life to reach those goals. I will share on our Spanish version, when you get that document at the end, you get 2 documents essentially. You'll get the Spanish version, and then right underneath the Spanish will be the English version. I think often our Spanish-speaking families have to interact with the English-speaking school or English-speaking waiver program, what have you, so they can use the one document that'll have it in both languages, so everybody can start working together on making these goals a reality.
Well,
I love the questions. I love the comments, you guys. This is great. I really appreciate the interaction on this discussion.
Well, and we appreciate your comments because I think that this is a wealth of information for people who are participating today and who would access this information. So I'm just going to ask Becky, if you wouldn't mind just putting your contact information back up on the screen. And then if you have any closing statements at this time that you would like to make, that would be wonderful.
Oh, I can't do 2 things at once. Okay, there's my contact information.
I got that, thanks.
As far as closing statements, I just really appreciate you listening to this idea and for the engagement that we've had both with families and professionals to make this a better tool and a better tool and a better tool. This is just a really early prototype, and so your feedback is certainly welcomed. And if you go out there and try it and there's a glitch, please email me and let me know you tried it and this was good, but that could be improved. Please tell me, let me know. We're happy to hear the feedback so we can make a tool that's most beneficial to the families in Wisconsin.
Well, Becky, thank you so very much for a very informative webinar today. I greatly appreciate it, and I'm sure that those in attendance have really been able to glean a lot of really great information from the gold cards that you've been talking about. So thanks again.
Yeah, thank you for the opportunity, Bonnie.
This concludes our webinar for today. We'd like to thank all of you for joining us. Please be reminded that Wisconsin Facets has over 100 scheduled trainings and webinars for 2022. And please check out our website calendar and register for any of those trainings that you may be interested in. Also, please watch for the short evaluation coming your way after today's live presentation. Again, thank you, Becky, and thank you all for joining us today. Everybody be well, stay safe, and have a good week. Bye-bye.